So as far as options for denture wearers or options for people that are about to lose all their teeth, when it comes to dental implants, what are their options in your practice?
Okay, well, option number one, to have what's called snap-on dentures.
Okay.
What are these are? We place typically 2 implants in the jaw, somewhere here in the front, and we still get, patients get a set of dentures that are snap in and out.
Okay.
How this works, basically, of course, at night you need to remove them to clean them. You don't sleep with them. What the implants do is provide a little retention, little snap mechanism, like a button in a shirt.
You don't like them, you say.
The problem is the patients don't like them. The report we get back is not so good because patients have been telling us these are still dentures. The problem is you have limitation what you can eat. You still have, to a certain degree, lack of confidence. They may still come out because it's Murphy's Law. They can come out. They're designed to be coming out still. Literature shows that more maintenance involved in the long term.
Like cash out of pocket.
Besides cash out of pocket and appointments to the doctor back and forth, because they tend to see this locking mechanism, let's say basically button if you want for the sake of simplicity, the snapping and out mechanism tends to wear over time.
Okay.
And then needs to be replaced, repaired quite often.
So what do you like to do?
So patients are not happy with those. Another option is to place a little more implants and put a fixed set of teeth. Okay. Their name as well on 4 or 6. Doesn't matter how you name it. The point is we place enough implants to support well a full set of teeth that is permanent, doesn't come out.
So like 4 implants, full arch of teeth.
At the minimum 4, more if you can.
Okay.
But regardless of how many implants, you put enough to predictably and well support a full set of teeth. Imagine, and it's a good example, a denture that's bolted with screws on the implants, doesn't come out, doesn't move, is bolted, done, finished. You chew, you love, you sleep with them. You don't have to remove them in front of your spouse at night.
Okay.
Always an awkward moment. You don't have to worry about coming loose. You don't have to come back and forth to the dentist for adjustments as much.
Okay.
With that being said, we're going to talk about the upper teeth. This is where we get the most compliments and satisfaction from patients. Why? Because now we expose the palate, we expose the roof of the mouth. When we do dentures or snap-on dentures, because they function the same way, give or take.
So the snap-in teeth cover the palate?
They cover the palate.
Okay.
So this doesn't let you to talk well. Why? Because it occupies a big portion of your mouth. Also, you don't taste the food as good because the food basically doesn't go on the roof to enjoy the food. What they like the most when we do permanent teeth on the upper jaw is the enjoyment of eating a meal, talk with more confidence, and also have more confidence as people because you have to worry about telling a joke and laugh with this. You don't have to worry about sneezing. You have to collect a denture from the floor.
And you could say, I mean, you've done 92-year-olds, 94-year-olds.
You have done.
Is that right?
You have done. That's
so
it.
age doesn't matter.
Age doesn't matter. As long as you have, these are all say that if you are healthy enough to drive or walk in our office, good chances you will be able to help you.
And they can eat whatever they want.
They can eat whatever they want. This 92 you mentioned, he passed eventually at the age of 100 years old. He lived 101 to be exact. He lived 8 years, spent time with his grandkids, going to restaurants, have social meetings. He used to be the mayor in the city, so he had a lot of friends all around the city. So he didn't have to feel secluded by having to remove a snap-on denture or a full denture all the times. He didn't have to excuse himself during a lunchtime to go to the restroom, to clean it out and be embarrassed in the restroom with people because you have to clean it.
So 70, 60 is very young to get this done.
It's very young.
And you could do it in as little, I mean, of course, everything has to work out. You have to have availability in the office, but like 2 or 3 appointments and you're done.
That's what typically takes. That's a typical scenario. And they get a permanent teeth, they walk out, some they can chew, they can use, they can smile, and they can go back to their lives.